For decades, the Centers for Disease Control and Prevention has recommended every child receive a first dose of the hepatitis B vaccine shortly after birth. Today, that changed despite fierce opposition from medical groups. The Advisory Committee on Immunization Practices voted to recommend the vaccine only for those babies whose mothers test positive for the disease. The measure passed by a vote of 8-3. For other babies, parents can decide with their doctors whether they should get the shot or not. Joining us to talk more on this issue is Dr. William Schaffner, professor of medicine at Vanderbilt University Medical Center. Dr. Schaffner, thank you so much for joining us.
Good to be with you, Veronica. Sure.
One of the main concerns of vaccine skeptics, including Health and Human Services Secretary Robert F. Kennedy Jr., is that they can cause autism. How important is it for scientists and the medical community to conduct safety reviews of the hepatitis B vaccine, and does more need to be done?
Well, we've been giving this birth dose of hepatitis B vaccine since 1991. So now millions and millions of babies have been vaccinated. And our program has been so successful that other countries are now adapting it also, including to the north of us, some of the provinces of Canada. Why are we messing with success? It's not really clear, because there have been no safety issues that have come up, and we monitor the safety of our vaccines very, very carefully. So many of us are concerned that now both parents and medical providers will be confused. You know, parents have always been able to decline vaccination if they wish. And I think now many children will have the consequences of infection acquired during birth. And that's very unfortunate. It's like turning back the clock.
Parents are able to still get this shot for their children if they work with doctors?
Absolutely. The shot will still be available. And I think the American Academy of Pediatrics and the American College of Obstetricians and Gynecologists will continue to recommend the birth dose, as does Dr. Bill.
So what is the recommended schedule for vaccines for children, and what is the medical argument for getting those immunizations?
Well, obviously, we have a whole array of baby shots that are now being given. And that number has expanded over the years because medical science has provided more vaccines to prevent more diseases, which means that growing up in the United States and increasingly around the world is healthier than ever, much healthier when I was that young. The American Academy of Pediatrics and other professional organizations look at the data very carefully, construct a schedule that we're using in the United States that's both effective and safe.
Dr. William Schaffner, thank you so much.
Thank you.